housing conditions and asthma, and we'll be discussing these contents today. Asthma overview. The purpose of our presentation is to highlight how housing, including the quality of houses and the communities people live in, can contribute to the onset, development, and worsening of asthma. Another purpose is to inform and raise awareness on this issue among provincial housing policymakers. Asthma is a chronic respiratory disease that creates inflammation within the body's airways, causing them to narrow, which makes breathing more difficult for the individual. Asthma is the most common chronic disease among children and the third most common chronic disease among adults, affecting 3.8 million Canadians, with 317 new people getting diagnosed each day. Asthma places a substantial economic burden on Canada, costing the healthcare system an estimated $52 million each year for direct and indirect expenses.
Inadequate housing and asthma link. When we refer to inadequate housing, we refer to living environments that fail to meet basic health and safety standards. These conditions are detrimental to health. Issues include poor ventilation, which prevents the effective removal of indoor pollutants, excess moisture, which creates ideal conditions for mold growth, and dust mites, which are often increased by ineffective heating systems. Also, overcrowding can worsen these conditions by restricting airflow and increasing the concentration of allergens and pathogens. These factors play a critical role in the health outcomes of people living in the home. Next slide. It's crucial to recognize that many asthma triggers are rooted in poor quality living environments. Homes with poor air quality, the presence of mold, dust mites, and inadequate ventilation significantly increase the risk of developing asthma and worsening existing asthma. The frequent exposure to these asthma triggers leads to more severe asthma symptoms and an increased prevalence of asthma attacks. To add on, overcrowding, commonly found in substandard housing, creates an environment where asthma attacks become more frequent and severe. Addressing these key housing issues is needed to improve health outcomes and reduce asthma prevalence.
Vulnerable populations. Vulnerable populations include minority communities and low-income individuals who are disproportionately impacted by housing disparities. Structural racism has concentrated minority groups in neighborhoods with substandard housing, displacement risks, and more limited resources. These conditions harm their housing outcomes and can cause elevated rates of asthma. Low-income families include those with respiratory illness vulnerability, and they struggle to afford houses and face discrimination in the real estate market. This causes them to face a dual burden of economic hardship and systemic bias and continues to trap them in health hazardous environments. These disparities stem from systemic issues and policy failures. Redlining and substandard suburbanization created an environment for white families to build generational wealth as homeowners, while minority families were segregated to under-resourced areas. This created concentrated communities that struggled with poverty. Social determinants like income inequality and discriminatory real estate practices continue to restrict marginalized communities from accessing housing that is safe for them to live in. Low-income minorities tend to reside in areas that have poor air quality, poor ventilation, or molds in the units, and this environment worsens their health conditions, including asthma. Addressing these disparities requires confronting the systemic barriers preventing equal housing.
Redefining asthma. Most people link asthma to lifestyle factors like smoking or poor diet, but this view is limited. It overlooks how poor housing, common in low-income and racialized communities, exposes people to mold, dust, overcrowding, and poor ventilation, all major triggers of asthma. Our group took a broader approach focusing on the social detriments of health. We emphasized how poverty and housing inequality significantly impacted asthma outcomes. We redefined asthma as a social justice issue, highlighting the need for systematic solutions, like better housing policies rather than just medication or lifestyle changes.
Poor income and housing conditions can significantly worsen asthma outcomes, leading to a range of health and social consequences. On the health side, individuals living in substandard environments visit the ER more frequently due to an increased amount of asthma triggers. They are also at an increased risk for developing comorbid conditions such as anxiety and depression. On the social side of things, the burden extends to missed school days for children and missed work days for adults, ultimately affecting their education and income. Other consequences include experiencing social isolation and increased financial strain due to continuing medical expenses.
Public policy solutions. Research shows that improving living conditions has historically had a greater impact on health than medical care alone. As a social determinant of health, housing directly affects asthma. Policies are upstream factors that influence the systems causing poor housing, while housing conditions are downstream factors that impact daily health. Firstly, development and enforcement of stricter housing regulations, which includes mandatory mold inspections, pest control, dehumidifiers, and improved ventilation standards, all of which address common asthma triggers. Secondly, affordable housing initiatives to help prevent overcrowding and reduce the number of families forced to live in substandard homes where asthma risks are higher. Expanding funding for these programs ensures that vulnerable populations are not left behind. Thirdly, governments can provide financial incentives such as tax credits or grants to homeowners to make homes healthier. This can include installing air filtration systems, repairing leaks, and replacing carpets with hard flooring. Fourthly, urban planning policies, which can help reduce asthma by limiting pollution near homes. For example, zoning laws can prevent factories or busy roads from being built close to residential areas, especially in low-income neighborhoods. Lastly, complementary approaches such as home-based education, support services, and healthcare visits help families manage asthma more effectively. Raising awareness and advocating for systemic change are key to reducing long-term health disparities.
Real world example. Real world example. Let's take a look at a real world example that shows how policy driven housing interventions can improve asthma outcomes. The Seattle King County Healthy Homes Project focused on low income families with children suffering from asthma. Community health workers visited homes and provided tailored interventions like moisture control, pest management, and allergen proofing. Families were also given tools like mattress covers and HEPA vacuums to help reduce triggers inside the home. Now let's talk about the impact. After these interventions, children had over 50% fewer asthma symptom days. Emergency visits dropped and kids missed fewer school days. Not only did this improve quality of life, but it also reduced healthcare costs. This project is a proof of concept that supports the kinds of policies we are proposing, like enforcing housing quality standards and funding home-based asthma programs. When we improve housing, we directly protect respiratory health, especially for the vulnerable populations.
To wrap things up, the connection between poor housing and asthma is clear. Living in unsafe conditions increases asthma risk and severity. It's not random, it's affecting low-income and marginalized communities due to long-standing systematic barriers. This isn't just a health issue, it's an issue of inequality. Reducing asthma rates means addressing the root causes, starting with stronger housing policies and better access to safe, affordable homes. Communities and individuals can also help by raising awareness, pushing for change, and supporting those most impacted. At the end of the day, safe housing should be a basic right, because when people live in healthy homes, they live healthier lives.